Hello, everyone. I'm Jason Tokarski.
And I'm Megan McGurman. Welcome to For the Love of Health, brought to you by ChristianaCare.
According to the American Heart Association, globally, cardiac arrests claim more lives than colorectal cancer, breast cancer, prostate cancer, influenza, pneumonia, auto accidents, HIV, firearms, and house fires combined.
Wow. CPR, especially if administered immediately after cardiac arrest, can double or triple a person's chance of survival. But could you administer CPR if you were called upon to do it? Joining us to break down the importance of CPR is Jen Oldham, Cardiovascular Quality and Innovation Nurse Program Manager at ChristianaCare's Center for Heart and Vascular Health. Jen, thanks so much for being here.
Thank you for having me.
Can you walk us through those first critical minutes when someone is having a cardiac arrest and explain why CPR is so vital in those moments?
Absolutely. Well, your heart is a pump, and so it pumps oxygenated blood around your body to get to all of your tissues, all of your organs, and make sure that your metabolism is going and your brain is active and your kidneys are functioning, your liver, everything that is working appropriately. So when your heart stops, you're no longer pumping blood. So therefore, you're not getting that good oxygenated blood flow to your organs and your vessels. So your brain can die, all of your organs can die. Essentially, you are dead without your heart beating.
There are probably a lot of misconceptions about CPR, when to do it, how to do it, and everything, and just in general fear of, oh God, am I going to do something wrong and hurt somebody? What are some of those misconceptions, and how do we get past those fears for people?
Absolutely. Well, education is the key to everything unknown, right? There are a ton of misconceptions. I've been doing early heart attack education for a variety of local businesses and all kinds of organizations that reach out and want it. One of the biggest misconceptions that I find going out into the field is that men won't end up doing CPR because they're afraid of touching a woman. I try to break it down and make it as friendly as possible for people who have that misconception that they're going to be touching someone. But at the end of the day, that's where the heart is. It's underneath of the chest and underneath of the breastbone. And so, there is anatomy there for all of us. It's not just one kind of person. Another huge misconception, I think, is that they're going to hurt someone. But this is very frank. It's probably the emergency department coming out in me. But you can't hurt dead. Dead is dead. And so if you don't push hard and fast in the center of the chest, you're not going to circulate blood. And so bones will break, ribs will crack. Maybe you have displacement of cartilage. It's uncomfortable, but it has to happen. Broken bones and broken cartilage can be mended. Once you're dead, you're dead. And so we encourage everyone to do CPR, no matter how much they think it's going to hurt someone. Hard and fast in the center of the chest is what needs to happen.
And maybe because of so many TV shows that we've been watching, a lot of people just automatically assume that the mouth-to-mouth is part of that as well. It seems like that's not quite the priority anymore to the CPR process. Is that correct?
That is correct. Initially, when CPR started, it was airway, breathing, circulation. So they thought initially that airway was the most important portion of CPR. And within the past 15 years, it's really moved to circulation and then airway and breathing. So it's a bit of a change, but honestly, you have oxygen in your blood regardless of if you're breathing or not. It's less than if you were breathing, but it's still there and it's still effective to circulate that oxygen around to just push first. So you do not need to do mouth to mouth at this time, especially with hands-only CPR. So people who don't have specialized training with BLS or ACLS, that the basic CPR, which is hands-only CPR, is just circulating blood, just using the heart as a pump as it's intended to be.
And I know with hands-only CPR and the original version of CPR, there are songs you can sing to make this kind of as easy for someone as possible. So if someone is listening to this and has never been certified in CPR, would have no idea where to start, what are some of those easy tips we can share with them right now that makes them feel a little bit more comfortable about it?
Well, the one that American Heart Association has touted forever is the Bee Gees Staying Alive, right? But if you have an audience that's younger than 25, they probably don't know who the Bee Gees are. So when I go out to elementary schools and I get that Gen Z or Gen Alpha audience, Baby Shark is 100 to 120 beats a minute. So as obnoxious as that song is, it's actually very effective, especially for younger people to kind of call a cadence into their head and be able to give the right compression rate.
We've talked about some very recent things to make it a little more accessible, a little easier to work with, be it the songs that we're using or removing mouth-to-mouth from the process here. What other innovations are making it more accessible and easier for people to get involved with this?
Sure. So, well, there's AED programs. So a lot of businesses have that automated external defibrillator, right? So the shock that your heart needs when it goes into a lethal rhythm. If you call 911 in Delaware, our 911 dispatchers have like a log of where all of the AEDs are in the surrounding area. So say if you picked up the phone right now because I had a cardiac arrest and you needed an AED, you called 911, they're going to say, oh, there's an AED wherever the AED is here in the building. AEDs are pretty widely available, and actually within my job and with our accreditations that we have for cardiology, we actually assist small businesses getting AEDs if they'd like them. So I have a ton of resources if anyone's interested for that. Besides the AEDs, there's a big initiative within the American Heart Association and the American College of Cardiology that pushes knowing CPR. There is movement all over the country. Delaware was tagged as one of those states to take up the initiative of educating our high school students on CPR, but I think it needs to be introduced way before high school. Like, this is definitely something I like to do in elementary school, because kids in elementary school probably have a younger sibling or younger, nephew or niece or someone in, their neighborhood. And so babies put things in their mouth. And so a lot of times your young kids are the first ones to notice that a baby's choking. So just getting the word out about early heart attack care, about hands-only CPR, it's a huge push. Certainly there are devices that can help with that. There's anti-choking devices that they have that's readily available. I can't say that I've ever used one, but I do know that they exist. They have like the to-go breathing bags. So if it's, you don't feel comfortable putting your mouth on someone, you don't have to, but obviously if you wanted to, they have those barrier masks that are readily, you can get them for like $8 on Amazon, right? So those are available. And then they also have, they're called Lucas devices. It's an automatic compressor, an automatic thumper that are BLS units. So our basic life support units, like the fire trucks, like the firehouses, and even some, I believe, law enforcement might carry them as well. But it's BLS trained professionals that they strap onto a person so that whoever else is taking care of that patient can open themselves up to administering medications or intubating the patient or making the necessary, treatments, establishing IVs, pushing fluids, things like that. So they've come a long way with technology.
I want to circle back a little bit to you having said that you're training kids in elementary school for CPR. My kids are a little older at this point. One's a senior in high school, one's in college. I don't recall them ever being offered that opportunity when they were that young. And it kind of actually surprises me a little bit. I never thought about like an 8-year-old being able to perform CPR. Is that really something that you're working on at this point? Is getting them that young, that into it?
Absolutely. I would love to partner with any of our elementary schools to get CPR in there. I know that our high schoolers definitely get CPR training. However, it's a lot of times that the younger kids are watching their younger siblings, and we know that babies put everything in their mouth. That's how they learn about their world. Giving them a little bit of training, not necessarily like a BLS level or even like a heart saver level, just that this is how to do hands-only CPR. This is when to get an adult involved. This is how to call 911. This is, how to talk to the paramedic when they arrive, I think are important points. They're pliable and they can remember and they can be assisting. How many grandparents watch their 8, 9, 10-year-olds children and might have an event that 8, 9, or 10, or even like 3 or 4-year-old might need to know how to, not necessarily perform CPR, but call for help. So I think that it's very valuable. So yeah, I would encourage any elementary school. I would be happy to partner, get your school nurse involved, because I'm sure that they have the same level of expertise, right? Like they can totally do a CPR curriculum and introduce it in baby steps, bite-sized pieces that elementary kids could digest.
Jen, you were recently honored by the American Heart Association at Delaware's Heart Ball. Congratulations.
Thank you.
Talk to us about your work at ChristianaCare.
Sure. So I took this role that I have now a little over 9 years ago. And at that time, we had started going through accreditation, moves to be accredited with the American College of Cardiology. And so one of the major pushes that we needed to kind of firm up before we could accredit was early heart attack care and hands-only CPR. And so, I've been involved since I was like 12 years old doing CPR, assisting with it. And then I was a provider and, immediately thereafterwards. But we had to establish a program and go out into the community and start teaching that. And the value just hearing, when I would see patients out at like the Heart Walk or some other event that I was at really was very powerful. And I heard a lot of positive feedback immediately. So I feel like every time I go out and do one, I get like 3 down the pike, which is, it's wonderful. I've trained other people to go out and do them. We have partners in the Cancer Center that take that message out to the community as well. I work with a bunch of the physicians, Dr. Erin Fender and Dr. Neil Wimmer. They are real, positive on taking information to the community. So I would say probably 2 or 3 times a month, I make time to go out to our whoever asks. If it's a church group, if it's a little league, or if it's a soccer club, like whoever. You touch a lot of lives that way. And when I'm asked to go back and repeat, they tell me how they've used the information that we've provided, that ChristianaCare gives me the platform to provide, hearing how they've either implemented changes in their life or they've encouraged someone in their life to seek medical care. And so it's super valuable. And the American Heart Association is just near and dear to my heart. Like, they are the reason that we have cardiovascular medicine and all of the advances that we've made over the last, 30 to 40 years, I guess. It's their partnership. And so when they ask me to do something, I always take the opportunity to say yes, because you never know who is going to be able to save a life.
Beyond CPR, what other life-saving measures, life-saving kind of back pocket skills should someone listening to this have?
I would encourage everyone to get CPR certified, right? Like, even if it's just like you go online and you watch one of the videos for hands-only CPR. But I think that it's incredibly valuable. Not only do they do CPR in the American Heart Association classes, they also do choking. So techniques to, the Heimlich maneuver. If you're choking and you're all by yourself, like how you can push yourself over a sink or the back of a chair to be able to relieve your choking. They teach first aid, right? So how to tie a tourniquet, that's super important. What if you accidentally, you drop a knife on yourself or something? Like, I think it's just very, it's important to know that it's not just CPR and it's not just, hands-only CPR or, the BLS, ACLS. Like, it's there's a ton of other information in there. So I think choking, definitely, I think every one of us has probably choked at some point in time. That, and then just knowing how to, like help an infant who's choking and can't talk.
You gave us a lot of tips here for being able to help other people. How to perform CPR on somebody else. And you did brush a little bit into being able to perform like the Heimlich yourself. But what are some of those other tactics and things that you should be doing for yourself, looking at heart health and such?
Absolutely. So first and foremost, to have a great relationship with your primary care physician, whoever it is, if it's a nurse practitioner, if it's a PA, if it's a physician, know your blood glucose numbers, know what your blood pressure usually runs. Lab work, like with your lipid profiles, cholesterol is super important. There's so many factors with heart disease that we can't impact because it's genetic, right? Like, you can't help what your mom or dad gave you. It's just the way it is. But you can mitigate it, right? We can make better choices eating. We can move our body. We can stay on top of our health. We need to know our numbers and we need to know where we are, as far as our risk factors go, so we know what to mitigate. So I think first you just have to really, have that good relationship with your doctor and know those numbers about yourself. Also, it's very important to, be able to take time for yourself and to know, like, we are creatures of I will do it tomorrow, because nothing bad's ever going to happen to us. I know that bad things happen to people who are great people and not trying to have anything bad happen to them. However, your body whispers before it yells. After it yells, then it's going to start screaming if you don't listen. So we really need to, I guess, take a minute for ourselves every day. How are we feeling? Is that shortness of breath new, that when we're going up and down the steps, like, do I need to call my doctor about that? Absolutely. If you have a new symptom, yes, you should investigate that. Do you have swelling in your ankles or in your hands? Or do you have a cough that just won't go away? Or, do you have a headache? What's your blood pressure trending? So yeah, to listen to your body. Your body definitely whispers before it starts yelling. And we are just kind of at a disadvantage because we're always so busy, right? Like, we can say, oh, I'll take care of it tomorrow. I'll take care of it next week. I'll take care of it after I take care of everyone else. We explain away our symptoms, right? Like, we think, oh, well, I have this weird discomfort in my shoulder because I lifted heavy at the gym yesterday and I didn't get enough water. Well, is that the case? Or, do you know are your lipid levels okay? Do you think it's really just a gym injury, or is it something more serious? And is there something more sinister kind of bubbling at the surface? So we do need to get better as a whole of listening to ourselves and our symptoms and making our own selves a priority.
Jen, I'm hoping that someone listening to this is now going to get certified in CPR, encourage a family member to potentially get their kids involved in being CPR aware, emergency aware. How can someone get in contact with you if they're interested in taking that next step?
Sure. I'm happy to answer any questions. I can be reached at joldham@ChristianaCare.org. And as far as like finding a CPR class or finding a BLS class or finding first aid, anything like that, I would say heart.org. That's the American Heart Association's website. They have a list of all kinds of locations, times, and providers that are happy to provide.
And I know anyone going to the Heart Walk in a few weeks will see you there as well.
Absolutely. We'll be doing hands-only CPR demonstrations. We have some swag. We have lots of education and information. We have a whole table set up. It's myself and my co-chair this year. Well, I'm her co-chair, Mary Kate Carroll. She's actually over the structural heart team. So she's doing a great job fundraising for them. It's super important because all of the money that I guess is brought in from the Heart Walk stays in Delaware. It goes to research efforts and education and programs for Delawareans. So super important. I'm grateful that every year ChristianaCare has continued to support. It's an incredible initiative.
Jen, thank you so much for your time and all of your life-saving work.
Thank you so much for the platform. Appreciate it.
Check out the show notes for this episode for more on CPR, the upcoming Heart Walk, and other life-saving information.
You can always keep up with For the Love of Health on social media. Just search ChristianaCare on your favorite platform.
We'll be back in 2 weeks with another great conversation.
Until then, thanks again for joining us.
For the love of health.